I think it's all about lovemaking. DC moms are not incorrect here. Google is information and misinformation.
Well, I've learned something today.
Hi there, I'm Dr. Biju Singh and I'm a gynecologist. I'll be answering some questions related to gynecology which have been put up with Kofuku, and I'm very happy to answer all of them. Good to go? Thanks, Sasana.
Okay, first question comes from 19F. How often are you supposed to wash down there? Like, genuinely asking. IDK, what's normal anymore?
Right, so it's not something where you got to be cleaning your body 24/7. So once a day is good enough, and that too mainly the outer part of the body, the vulva, not internally. Internally, the vagina washes herself, you see. There's secretions, there's good bacteria fighting with the bad bacteria, and they take care of the internal issues. But outside, yes, we would recommend that you at least once a day wash the body. Maybe a little bit more in terms of frequency when you're menstruating. And we do tell our patients to refrain from using cosmetics or scented soaps or, something which is artificial. Try to keep it simple. Simple soap and water once a day is good enough.
22F. Do tampons actually make you looser, or is that just dumb? Like, I swear I feel different.
I think that's a very common question, but the answer is very simple. The answer is no. The vagina is muscular. It has elasticity. Just imagine, babies at 3 kgs, 3.5 kgs, such a huge mass of flesh and bone is coming out from the body. So a simple, small little tampon is going to do nothing. So no is the answer. Don't worry about that.
Can stress really delay your period?
Yes, it can. Actually, we see young little girls who are taking exams in schools, colleges, and they'll end up with delayed periods because of the stress. The brain affects the ovarian system because there's an axis, the hypothalamo-pituitary ovarian axis. We also see this when there's a bereavement or some sort of unhappiness in the family. You are depressed, you're sad. That also can affect your menstrual cycle. So the brain, the stress, the anxiety definitely can affect menstrual cycles.
21F. How the fuck do you know if it's PCOS or just your hormones being annoying this month?
So PCOS is a different story. Hormones annoying you are a different story. PCOS is related to a different sort of hormonal imbalance, which would be a syndrome which could involve a lot of metabolic factors, obesity, hair growth, diabetes in the family, fatty liver, lipid profile being deranged, and blood pressure. So we address that a little differently with a hormonal study, weight loss, and probably a hormonal correction. For the PMS and people who get really nasty during the periods, we do recommend oral contraceptive pills. They level out your hormones and make you a little more comfortable and, should I say, a little more friendlier to the opposite sex.
I'm not trying to be gross, but does anyone else just randomly itch down there? Like, why?
So itching is quite common because the skin is an organ which probably gets dry, lack of moisture. Age also related because as you become older, estrogen levels fall and the skin becomes, drier, less elastic. Having said that, also yeast infections, fungal infections, bacterial infections are common because that's the menstrual cycle happening with blood, and bacteria loves growing where there's blood. So itching can be there, which is pathological, which is secondary to some sort of infection. Again, wearing tight clothes might aggravate that. But a little itch can happen. And if that little itch goes away by itself, then that's pretty normal.
28F. Boobs start hurting like someone uppercut me before my period. Why? Who designed this feature?
I think God designed everything, so we'll have to ask God. But if I can try and play God and answer that, probably the answer again is hormones. The mammary gland is meant for lactation. The glands develop, and with the help of certain hormones, milk production is facilitated. It does happen that we do see some hormonal imbalance again, which could be related to weight, the mental state, and we have a hormone called prolactin, which probably gets very high. And when prolactin gets high, your bust does tend to hurt, the nipples hurt. You can't even wear innerwear. You become irritable, you become bloated up. But the remedy is very simple. We can give medicines to bring down the prolactin level, vitamin E, omega-3, primrose oil. There are many things that you can give to ease those symptoms.
Can tight jeans actually give you an infection, or is that something Desi moms made up to scare us?
Well, Desi moms are not incorrect here. I'll agree with them. We like to be fashionable. Tight jeans, of course, look good, but definitely it decreases the circulation, decreases ventilation. And in a country like India, where you have a lot of humidity, and if you sweat a lot, yes, you'll be prone to more bacterial and yeast infections. So if the answer is straightforward, it's yes, it does increase, but you can't actually stop wearing tight jeans because, well, fashion. You can't stop fashion. So guys, thanks for watching, and if you have any further queries and you want your queries to be answered in an authentic, professional way, then please log on to Kofuku. That's where all your questions will be answered in the correct way and in the right way and in a very informative way.